Sleepiness, bedwetting, even attention disorders and depression, all common issues children can face. Good evening, I'm Dave Corvassier.
And I'm Tricia Kean. What if we told you these are issues that could possibly be fixed by a dentist? Well, I spoke with one mom who says a dental treatment is making all the difference for her daughter.
It's just easier to have conversations with her where she's not like losing focus.
V. Jen says she was experiencing some hyperactive behavior from her daughter Penelope. But the 8-year-old started getting treatment from self-proclaimed tooth wrangler, Dr. Dee Meavison. And you noticed her behavior changing as well.
It did. As we've been through this process, she's more calmer, as well as some of the symptoms that she was going through that we were concerned about.
The treatment is called myofunctional therapy.
She basically has to wear an applicator daily. So definitely at night, throughout the night she keeps it on, and then throughout the day we try to have her do exercises, like mouth exercises.
As you initially embarked upon this, did you ever think that was so meaningful, how your teeth could tie into bigger issues?
I really, honestly, my husband and I didn't think that it was, and it's the education that we were provided from the office here that really got us to recognize that.
Dr. Dee first got involved with myofunctional therapy while looking for a treatment for her own children.
I have sleep apnea, and I was starting to see signs and symptoms in my kids, and that was unacceptable.
Dr. Dee says her daughter would fall asleep breathing through her mouth, leading to snoring and ultimately not getting a solid night's sleep.
So what a child who has sleep breathing disorder or someone with sleep apnea, their airway is about this size. But what we want to grow it to a healthy size like this. This is a healthy adult airway.
Developing a strong airway begins with healthy development of the upper and lower jaw. Myofunctional therapy consists of a series of appliances, kind of like a sports mouth guard used for mouth and tongue exercises.
So they actually put the tongue in a certain position. You'll do some exercises with them, and that's the myofunctional therapy. But it also guides the teeth in position, in turn develop the airway, and the teeth come in straight too.
But the benefits don't end there.
Children with conditions such as teeth grinding, mouth breathing, ADHD, not being able to focus in school, and a lot of this stuff is misdiagnosed. It could be symptoms of sleep breathing disorder, which leads to sleep apnea if untreated.
It may not solve behavioral issues for every patient, but Dr. Dee is seeing positive results with many of her patients.
I have a mom of 3 kids. She tried it on one. She came back right away and wanted the other 2. She goes, I'm sleeping through the night. I can't believe it. I haven't slept through the night in 12 years.
Best of all, it's covered by a lot of insurance companies, and it's a natural approach requiring no surgery.
The bedwetting, the grinding of their teeth, the mouth breathing, those are big things, snoring. We can screen the child and see if that's a good option for them.
As for V, she says it's definitely been a great option for her family, and she's recommending it to others.
I just kind of share our story. So I have shared with some coworkers and some friends, and I tell them, do your research.
And we have more information on myofunctional therapy on our website. If you're interested, just go to ktnv.com/dental therapy.